Hey everyone, and welcome. So if you share your home with a cat, you know they are, well, they're mysterious, right? But probably their biggest secret is how they handle being sick. So today, we're going to dive in and learn to decode their secret language so you can tell when your little buddy isn't feeling 100%.
And this right here, this is the real challenge for every single one of us cat people. They are absolute masters at hiding it when they feel bad. I mean, you could be the most attentive cat parent on the planet and still miss the signs, all because they are hardwired to hide any kind of weakness.
So why? Why do they do this? I mean, it doesn't make a lot of sense at first glance, does it? You'd think they'd want to let us know when they need our help.
Well, here's the answer. It all comes down to one thing: survival. Out in the wild, cats aren't just hunters, they're also hunted. So if a cat looks sick or weak, it's basically wearing a giant eat-me sign for a bigger predator. This instinct to hide illness is so deep, it's still running the show for that fluff ball currently snoozing on your couch.
All right, let's get into it. Level 1. Think of these as the whispers. They're the super subtle clues that are really easy to overlook, but catching them early is absolutely key. It's all about being a good detective.
Okay, let's start with something you can actually measure: weight. A change of just 5%. I know, it doesn't sound like a lot, right? But for a 10-pound cat, that's half a pound. Over just a few months, that's a pretty big deal. It's your first little flag to just start paying closer attention.
But what if that number climbs to 10%? Now we're talking. A 10% change in weight, up or down, is a big enough deal that you should probably give your vet a call. Even if your cat seems totally fine otherwise, this could be the very first sign that something deeper is going on.
Okay, check out these two patterns. You absolutely cannot ignore these. First up, your cat's eating fine, but they're getting skinny and drinking a ton of water. That could be an early whisper of kidney trouble. But this second one, this one is a classic. The cat that eats more than usual, I mean they're starving all the time, but they're still losing weight, that screams hyperthyroidism, especially in middle-aged and older cats. And it's not just about weight, you know? Look at their everyday routines. Is their fur looking a little messy? Maybe they're not grooming as much. Or are they spending all their time hiding under the bed? What about that epic jump to the top of the fridge? Do they hesitate now? Even a cuddly cat suddenly turning standoffish. These are all pieces of the puzzle.
All right, moving on to level 2. Now the whispers are getting a little louder, these signs are more obvious, and they're basically your cat's way of saying, hey, something's definitely up. This is when you call the vet.
Let's talk about bad breath. And I know what you're thinking, but it's almost never just cat breath. A staggering 85% of cats over 3 years old have some form of dental disease, and it's painful. But listen to this. That smell can also be a sign of major problems with their kidneys or liver. So yeah, take it seriously. You know, the litter box is basically a daily health report, if you know what to look for. Any change at all is worth noting. Are they making a bunch of trips but not much is happening? Or are the urine clumps suddenly massive? And of course the big one, are they going outside the box? Any of these could point to anything from a UTI to kidney issues or even diabetes. So here's a quick checklist of things that definitely mean call the vet. We're not talking rush to the emergency room yet, but you can't just wait and see with these. If they won't eat, if they keep throwing up, if they're sneezing constantly with gunk coming out, or you see that weird third eyelid a lot, yeah, time to get a professional opinion. Okay, deep breath. We're at level 3 now. These are the sirens, the red flashing lights. These are the signs that mean you drop everything and go to an emergency vet. I know it's scary, but with these, you cannot wait. You have to act, and you have to act now. And this is number 1 for a very good reason. If you see your cat struggling to breathe, panting like a dog, or breathing with their mouth open, that is a life-threatening emergency. Full stop. No exceptions. Go to the vet immediately. This one's pretty straightforward, but it has to be said. Any kind of major bleeding that doesn't stop, from a cut, in their vomit, anywhere, is an emergency. Don't wait and see. Seeing a cat have a seizure is absolutely terrifying, and if it goes on for more than 3 minutes, or if they have one right after another, you have to get them help right away. It's a true medical emergency.
Okay, everyone, please listen very carefully to this one. This is especially for owners of male cats. If your cat is trying to pee, maybe straining and crying but nothing's coming out, that could be a urinary blockage. It is incredibly painful and it can kill them in under a day. This is one of the biggest emergencies there is.
And then, of course, there are these. You know they ate poison?
Go. They got hit by a car or had a bad fall? Go. They're totally limp and won't respond to you? You're already on your way. These are no-brainers.
So wow, we've gone from quiet whispers all the way to screaming sirens. What's the bottom line here? It's you. You are your cat's first line of defense, their #1 advocate. So let's bring it all together and talk about how we go from just reacting to being proactive. Think of it this way, a simple 3-step plan to help you feel confident. Step 1, observe. You're the detective, watching for those small changes. Step 2, call. When you see a real pattern, you get a professional involved. And step 3, act. For those big, scary signs, you don't hesitate. Observe, call, act. Simple, right?
And this really is the key to everything. Your cat's health isn't just up to the vet, and it's not just up to you. It's a partnership. It's you at home noticing things no one else would. And it's your vet with their medical expertise putting the pieces together during regular checkups. Your eyes and their knowledge, that's the best medicine there is.
So at the end of the day, it really all boils down to one simple fact. Nobody knows your cat better than you do. You're the expert on their quirks, their habits, their normal. So trust that knowledge. Trust your gut. Thanks so much for joining me. Now go give your cat a good, long look. What are they telling you today?